Today I'm honored to join you to discuss the pivotal aspects of therapeutic practice deeply rooted in leadership in the American Hippotherapy Association. This association advocates for the powerful and meaningful benefits of horseback riding and equine interaction between the animals and the client. This is a catalyst for these beliefs of education in the specialized field of therapy. The human-horse connection has been rooted in research, furthered education to grow exponentially. Their mission reads, "We aim to improve lives by advancing education, best practices, and resources for licensed healthcare professionals who incorporate horses in skilled therapy services." There's been a transformative impact of incorporating hippotherapy into treatment. The AHA's promised dedication to advancing this therapeutic technique and modality has resonated very much with my commitment to increasing the patient's outcomes and furthering client-centered care. It is a shared dedication and passion that brings me here today to give you some insights on furthering this agency through leadership roles. So first we need to look at what is an Uber trend. An Uber trend are ideas that further our beliefs and make our beliefs resonate more in the world with the advances of technology, climate crises, and other topics that are relevant to these. The first one that we can look at that impacts leaders in the AHA Association is globalization. Leaders in this agency have access to global best practices and innovations in hippotherapy from around the world. Global resources, best practices, and partnership, they can strengthen the agency and the profession itself to ensure that hippotherapy remains relevant. Locally, the participating locally in leadership positions within this organization is related to hippotherapy and equine-assisted therapy can enhance the role of a professional in many ways. Advancing education, remaining current and up-to-date with best practices, networking, collaboration, offering opportunities for professionals to network with peers. This is thought of as a relationship, that leaders can be a process of collaboration that occurs between leaders and followers. And lastly, implementing interdisciplinary groups, that these colleagues can have the ability to advocate and recognize and integrate hippotherapy into mainstream healthcare educational systems and further raise awareness. And nationally, professionals in the national leadership roles can participate into teacher planning and resources for allocation discussions. This can be a great revenue. Miscellaneous educational access to or about therapy services is very important. Healthcare informatics is more than information and technology. It is the development, application, research, and education of this therapy technique. Next is setting standards. Professionals in national leadership roles that are being enhanced by participating in them can contribute to the development and implementation of national standards, guidelines, and best practices for hippotherapy. 5 Pillars states, leaders who exhibit these competencies and nurture them in others will lead us towards a reimagined healthcare delivery system, one where all communities and individuals reach their highest potential for health. And lastly, national influence. According to Wu and Green, today 4 in 10 Americans report having a chronic condition. The national influence and national leadership roles can provide a platform to advocate for these advancements and recognition of specialized therapy, such as hippotherapy. Lastly, an international role can create knowledge exchange. International leadership roles have the opportunity to be enhanced by engaging in a cross-cultural knowledge exchange and collaboration with different experts all around the world in different countries and cultures. Sharing best practices, research findings, and innovational approach can really shape the scope of this practice. Next, cultural sensitivity. Occupational therapists have a more forefronted mind when it comes to being sensitive to culture. Understanding cultural beliefs and values, adaptating effective communication, and respecting personalized goals, priorities can emphasize the importance of learning therapy goals with a client and provide aspirations. Lastly, the advancement of innovation. The notion evidence-based practice refers to the integration of best research, evidence, clinical expertise, and patient values in making decisions about the care of individual patients. The digital era is breeding through digital transformation, a hard-pressing advocacy for including the digital experience in any type of framework for the benefit of the overall patient experience. For example, there can be an increase in digital technology such as video conferencing, online research, and social media platforms to gain not only advocacy but best communication. And lastly, the environmental crisis. Sustainability into hippotherapy and advocate for environmental leadership and education stakeholders about these environmental impacts can be very important. Application for future growth needs. Theory X can be looked at through these leaders prioritizing training programs to emphasize skill development and hippotherapy or compliance with regulations. On the other hand, Theory Y can be looked at to apply future growth needs, empowerment, and trust. This assumes that individuals are motivated and responsible. An integration for needs for future growth can be applied through both theories of leadership that would involve balancing a mixture of both theories and approaches based on what the situation comes forth. For example, one should maintain standards while also empowering therapists to constantly innovate through their creativity through improving practices. In conclusion, leadership theories provide a framework for understanding how we all can effectively guide and inspire within the AHA Association. By applying Theory X and Theory Y judiciously, we can balance structure empowerment, fostering cultural innovation and excellence in hippotherapy practice. Here are my references. Thank you.